the health sector right now. Of course, we've talked about the power already. We've already done that and talked about security, now health. Nigeria's health sector in the third quarter of this year recorded some achievements, but the sector also encountered some problems that challenged the efficiency of government and health professionals in the sector.
But in July, news of allegations and counter-allegations between the Executive Secretary of National Health Insurance Scheme, Professor Usman Yusuf, and the Minister of Health, Professor Isaac Adewale, made major headlines. Now, the crisis in the NHIS all started after some allegations of fraud, nepotism, and outright abuse of office were leveled against the suspended Executive Secretary.
An unknown illness in Kwara and Kogi State threw many families into mourning, leaving health authorities with a puzzle to solve. The strange disease reportedly killed about 136 persons in both states and was later diagnosed to be gastroenteritis. Activities at government-owned hospitals were almost grounded when resident doctors and joint health sector unions, Johisu, commenced a nationwide strike.
Well, after negotiations with representatives of the individual unions and government, the strike was suspended. A major challenge in the last quarter was the outbreak of cholera in Borno State, northeast Nigeria. The disease claimed the lives of at least 44 individuals in the state.
Now, the number of suspected cases now stands at more than 1,000, with hotspots in various sites for displaced persons in Maiduguri, Dikwa, Munguno, and Konduga. We have our guest right here in the studio. He's Shola Ogundikpe. He's a health editor, Guardian newspaper.
Vanguard
actually. Vanguard newspapers. Good to have you on the show this morning. Well, Nigeria continues to rank low in the global indices for health. Out of 195 countries, Nigeria ranks 140 or thereabout. Very bad narrative for the giant of Africa. Why are we here? Are we taking health really seriously if we say health is wealth?
Well, thank you very much. Yes, it's not the first time, that we've ranked so low. In fact, it's almost become a recurring incident, and the reasons are quite obvious, really. Basic health, the indicators of basic health are not readily available. We don't have potable water. There is no good access to healthcare delivery. And, generally there is a sense of despondency, within the populace, as a whole. And you find that even though government is doing its best, government is trying,
is government really doing its best?
The problems.
Can you really say that?
The problems, well, within the circumstances, the problems are so monumental. There are so many that it seems as if you have so much to do.
Like she said, can we really say the government is doing its best? Because first off, look at the amount earmarked for the health sector in this year's budget, just 304 billion naira. If you look at the money the government is owing resident doctors and the rest of all, it's way below the amount. Nigeria is signatory to the Abuja Accord of the African Union in 2001 that at least 15%.
13% or thereabout.
No, it's supposed to be 15%.
15%.
But UN is 15% in Abuja AU, and then UN says 13%. And Nigeria is a signatory to these two agreements. Yet, a paltry 304 billion naira. Someone broke it down and said, with this budget, it means that the government is spending just 1,688 naira on each citizen. And we're saying the government is doing its best? Really?
Well, I'm not a government person, so I'm not speaking for government.
Yeah, I know.
Well, that's what we're told. That's what government tells us. But definitely the feelers, the indicators we get from the public out there tells us that, this government is not really changing, it's not really changing the status quo. You know, it's not entrenching that sense of, you know, belonging within the populace. You find that in a situation where you don't have that confidence, you know, that confidence in the public sector, public health sector is not really being entrenched, you know, within the populace.
Well, how do you build public confidence, really,
Yes.
from what you've been able to see covering that
in the first
sector?
place, you know, is health really one of the cardinal projects of this government? You know, how much does this government really goes out to ensure that every Nigerian has good health? You know, that is the first question, because every Nigerian you speak to today will tell you, look, you don't have good health. You know, access to health, the access is not there. Even when the access is there, the quality of service you get, you know, is questionable. And we all know that there's you know, there's an economic downturn, you know, and all that. There is no buffer, really, no health insurance to speak about.
NHIS?
So, yeah, but you know, NHIS is just the coverage is minimal,
And it's mired in controversies now, anyway.
it is not even, it doesn't spread down to the grassroots. So you find that essentially the average Nigerian does not really have a good story to tell, you know, about personal health care and general health care. And I think that is where we should look at our assessment. Although government tells us, yes, there are a lot of challenges, and like I was saying earlier, the health sector has been in crisis for so long. In fact, it seems to be permanently in crisis.
Long before recession, long before the economic
Definitely, you know,
downturn.
Even during the economic boom.
Even the economic
in the
boom.
last decade and a half, you know, it's been one crisis after the other.
I recall during the, you know, a couple of military interventions in the past, and when you hear that martial music, and whoever comes on the radio would say that hospitals have become mere consultancy centers.
Yes.
I wonder how much has changed since, you know, all of that time, and we're talking about the 80s, and now we're way into the 2000s.
Well, we, you know, it's a mixed bag, really. You know, we've made progress in some areas and also fallen back in other areas.
Which areas can you say that we've actually made progress?
Well, if you look at, I will say the government is more, our health sector is more one that is responsive, you know, in the sense that if there's an outbreak,
but not
of an
proactive.
illness, yes, it's not proactive. That's where I'm going, you know. We wait for things to, you know, wait for disease, epidemics and all that, and then we start planning, you know. I'll give you a very good example. Lassa fever. Lassa fever is a seasonal disorder, you know. We know it's linked to the dry season. And it happens every year, you know. But you find that every year it almost still catches us by surprise. You know, we still kind of run helter-skelter trying to cope with the outbreak, even though there are indicators to tell us that this is a seasonal illness that will break out, you know, in the dry season. So where are those sectoral, you know, those units, you know, in place to ensure that even though there's going to be an outbreak, you know, it will be minimal.
Sure.
And that has really been the problem. You know, we tend to be more reactive, rather, that's the word, not responsive. We tend to be more reactive than.
I saw something on the social media yesterday, and it really broke my heart. An American health expert there, Sean Murphy, posted it. He put up a picture of a linear accelerator that treats cancer. He puts the picture there and said, this is a linear accelerator. It treats cancer with radiotherapy. Nigeria has 18, but 11 are broken. USA has 2,500 plus 65 more just for animals. 65 more just for animals. He now said, so a dog with lymphoma in Miami has a better chance of getting treatment than a woman with a brain tumor in Lagos, Nigeria. Shame. How do you feel, really, as a Nigerian? And this really captures
everything.
The health sector
Yeah.
of the country.
I don't feel good, and I don't think any Nigerian will feel good, about that. I don't think he gave a breakdown of, the number of those, the equipment he spoke about, because there are some that are in the public hospitals.
And some in private.
Yes, and those in the private. I think he said about, I
18?
don't know what number he said.
18,
are
11,
functional.
Down.
Well, I don't know as at now, but there was a time in this country that there were virtually no functional linear accelerator in any public hospital in this country. Those that were functional were in some of the highbrow private hospitals. I don't know now if...
And those come at very, very huge costs. So let's even talk about medical tourism that costs Nigerians about 500 billion to a trillion naira every year. That's how much Nigerians spend. And I'm just wondering, imagine if this kind of money could actually find its way within the system to provide healthcare. Should we even begin to say, look, governments, you really cannot handle healthcare anymore. Maybe the private sector should be leading in that area.
Yes, well,
since government seems to be failing,
yeah,
and you have government officials who go abroad to treat the maddest of ailments.
That is part of the, confidence I was talking about earlier. Instilling the confidence in the public. If we have government officials, going out of this country, for healthcare. What does it say about the healthcare sector? Is it a vote of no confidence?
That's what it says.
I think example is the best teacher. And it's always good, the expectation is that every government will lead by example. So if we're having such, huge capital flight, definitely it's not sustainable. And I don't think any country will sit back or should sit back and fold its arms, and watch that happen.
Another problem now is even the brain drain, really.
Yes, the brain drain.
The brain drain, the best of hands in our health sector. Traveling abroad, there is hardly a hospital you'd go to in the United States or UK that you'd not find a Nigerian there.
Let me even put that in perspective for you. In the United States, for example, 70% of the black doctors are Nigerians. 70%. The best pediatrician in the world is actually a Nigerian, and he's based in the United States. And we could reel out, all of this information. But the point is anyone really listening? When you have a budget of less than 5% for health on a yearly basis, and that has been the consistent thing down the line, even before this administration, where do we go from here?
Of course, knowing that doctors yearly now go on strike to clamor for their rights.
Yes, well, I think, we just need to really set our priorities, once and for all. If we keep, year in, year out, I'm not sure we've met that target, the 15% allocation of budgetary allocation.
We've not.
To health.
It's about 6%. It's less than 6%.
But there are countries that meet and even exceed that. And I think it has to do with our priorities. Really, what are our priorities about health? So if we set our priorities, we'll know what we need to put first and how we need to go about it. And even then, it's not just about allocating these 15%. It's also about the implementation. How are the funds utilized? That also matters. True. How do we? You give a breakdown earlier on about how much someone did the calculation. How much the budget?
Yes, 1,688 naira.
Definitely. I'm sure if we compare this with even in Africa, other African countries, we'll see that we fare rather badly.
Yeah, countries like
Kenya. Libya is just
in crisis. Wow. Egypt already doing far. Let me put it this way: much higher than Nigeria, 90 and 107 respectively. those are African countries in crisis.
Definitely.
That's what life expectancy in Nigeria is very low, about 52 years compared to that of Libya. It's quite high.
Yeah, life expectancy, it's appalling. I mean, well, I think it's beginning, it kind of stabilized at a stage. The experts now, tell us that it's even beginning to go up now.
What measures have been put in place to let it
yes,
go up?
so
all right, thank you very much for your analysis. Shola Ogunripe, you're a health editor with the Vanguard newspaper. Thank you for coming to the show.
Thank you very much.
All right, health is wealth. Whatever Nigerians can do to stay healthy